All right, Dr. James Ryan, tell us how you would start off by treating tinnitus.
Well, the first thing is we always look at the most common areas that are successful. And so in setting up for the tinnitus treatment, we will first take a look at the patient, use some of the anatomy of the head. So if you look here at the tragus of the ear, and then you look at the angle at about a 45 degrees behind that, this right here is where we would treat typically for tinnitus. There are patients that will also respond to other regions. For example, each side you have this, the auditory cortex, the primary and secondary on each side, and there's a communication that runs between them. And so for some patients, the focus of the tinnitus will be here in the parietal, and for some even in the occipital lobe. And so sometimes you can run medial, at times we'll actually run bilateral on each side.
Can you show us how you run the bilateral or medial protocols for the occipital and the auditory?
Yes, and
or the parietal, I'm sorry.
And so typically for most patients, the most common, the most effective location for treatment of tinnitus is going to be about a 45-degree angle. However, if you look at the arc between those two regions bilaterally in the somatosensory cortex and the parietal lobe, you'll see that for some patients, they may respond medially. For most that I've seen so far, it'd be somewhat off the center line, and so bilaterally right there in that somatosensory cortex. And then for others, I've also had patients that respond well just medially in the occipital lobe.
Can you show us how you place the coil for both of those locations?
Yes, so for the most common region, we will typically just take the coil, and you can use it again, as I mentioned. Sorry, I'm going to move your hair behind your ear here. We'll use the most common location first, and so you will set this up and you can deliver the first treatment to assess for whether it's going to be something that the patient's going to respond well to. So again, tragus, about a 45-degree angle, and we'll place the coil here, and we can deliver then a treatment for 40 seconds of continuous theta burst stimulation. And for most patients, they'll respond right away. So we can then ask, do you notice a difference? Most patients say yes, but just in the opposite ear. And so then if the answer is no, then we'll then take a look and trial a few other places. The most common would be, again, if we're treating here and you think of these two regions connected, kind of follow that up in an arc. And here, more medial is where we would begin. This is where I would test to begin with. That would be the second most common location.
Can you tell us why you would choose that to test to begin with?
The reason why is that this has just been from experience with patients, but when you look at the auditory cortex on one side, there's a communication that runs between the two. So because of that, often following that tract tends to be another successful treatment area. And so with that in mind, we'll take a look at the normal positioning here, kind of follow that tract up, and here medially is where it plays. So given the angle of this tract, I would also mirror the treatment paddle for that location. So I would then set it approximately here, laying flat on the head, and then deliver that treatment. And then afterward, you can then again ask the patient, how did you respond? Do you notice a difference? And most patients know how to trigger their tinnitus, and so they will then move their head to the right or the left or downward, and then they can tell the difference. And so then once we find that treatment location, typically in most cases that will be a bilateral treatment to target both ears. In a few instances it might be actually a different location on the other side of the head.
Do you do bilateral if you find that they respond in the parietal location here?
Well, sometimes it'll run to parietal, can get a little bit closer to even occipital, and again it depends on the patient.
If you treated one side, would you also treat the other for tinnitus?
Typically, it depends on the patient. So some patients only have tinnitus in one ear. I've found that most have bilateral. And so because of that, I'll always treat on both sides.
Both sides.
However, sometimes the treatment on one side, so let's say, for example, the patient responded well here at the temporal parietal cortex, the most common treatment site. They may not, that would be treatment, for example, on this right side, they would treat the left ear. The opposite ear may actually respond in a different location. And so that's something that you've got to look at. So when I am assessing for treatment location, I look at each ear individually and then I can try to target by just doing a couple of test locations, and then the patient will let me know whether that's been something that they've noticed a difference in the tones, the frequencies, the volume, and some patients will also report that they immediately have improved hearing too.
And in your experience, how long does this treatment typically last, and how severe do the symptoms start out, and what do you usually bring them down to at 1 to 10?
So for most patients receiving the tinnitus treatments, we will typically see a fluctuation between the first, second, and third treatment. So sometimes their tinnitus may actually worsen, especially after the first to second treatment. They'll notice vast fluctuations, but typically by the fourth treatment, most patients have had completely resolved symptoms. And then you continue to repeat them up to 10 times, it produces a much more lasting effect.